Welcome everyone. Welcome to the Integrative Oncology series of There is Always Hope, because that's what we all believe in always. No matter which stage of life we are in, which stage of cancer we are in, we always see a ray of hope, and that's what keeps us motivated, keeps us going forward in this journey of this whole new world of cancer. So. On the same lines, we decided to do a series on integrative oncology and the different aspects of it, which is the medical treatment, and with that, the complementary aspects of healing. So, how can we bring different modalities of healing together? So that we can improve the quality of life, we can extend the life, and we can cure from this disease. So today we have the host, Dr. Pooja, with us, and I'm Dimple Parmar. I'm the founder of ZenOnco.io and Levels Cancer. We guide cancer patients on different integrative oncology approaches in terms of the medical treatment, or the Ayurveda, or it is the onconutrition and the different aspects of healing, which we all do when somebody is diagnosed with cancer in our family. And I have with our host today, Dr. Sujata. So, Dr. Sujata, over to you to introduce yourself.
So thank you so much, Dimple. So welcome you all on this beautiful platform where we see that each one of us who walk on earth has a right to have a joyous living. So the various aspects which comes to life, and one of them could be the aspects with regards to diseases and cancer, often seen as a dreaded disease by most of the people. They need to have a new insight, new possibilities with regards to healing them. It's not just healing, treating, whatever way, but yes, you have a right to live and you can do it. With that motto, we have come together, that is ZenOnco.com and Dr. Sujata Singhi, to bring up this platform where we will have a plethora of experts coming in to share their knowledge, their wisdom, and give a new ray of hope. As rightly said by Dimple, yes, there is always a hope, and where there is love, there is always a cure. So on to Dr. Pooja. It's really a pleasure having Dr. Pooja with us today. Dr. Pooja Ghatalia is a medical oncologist at Fox Chase Cancer Center with an interest in genitourinary oncology. She has led and designed several clinical trials and holds research grants in the field of urologic oncology. Her present research is focused on identifying epigenetic targets of the therapy in bladder and kidney cancers. She is also involved in translational effort aimed at studying epigenetic modifications as a biomarker of immunotherapy response. So we are looking forward to a very, very insightful and a real ray of hope from a researchist who is going to show us how life can get better for the ones who feel that they are on the other edge of life. So a very warm welcome to Dr. Pooja Ghatalia, who is joining us from Philadelphia, USA. Thank you so much. And over to you, Dr. Pooja.
Thank you, Dr. Singhi, for such a warm welcome. My name is Pooja Ghatalia, and I'm a medical oncologist at Fox Chase Cancer Center. I have lived in India for most of my life, and have come here since college and going forward. So it's a privilege for me to talk today to my fellow men and women in India and inform you about cancer awareness and treatment. So today I'm going to be focusing on what is cancer, cancer prevalence in India, what are the risk factors of cancer, how do you reduce these risk factors, some of the treatments for cancer, some common myths for cancer, coping with cancer, and then at the very end, I'm going to be leaving a lot of question and answer session time. I'm going to try to wrap up the PowerPoint that I have before you in about half an hour, and then we will have the remaining time available for question and answers. So what is cancer, and how does cancer actually originate? So I'm going to show a simplistic format of that, although cancer formation and development is a very complicated topic. And probably the 30 minutes that I have is not going to be enough to show you the whole spectrum of it. So when people mention a cell, what exactly is a cell? So a cell is a basic unit of human life. And a cell is a structure in the body comprised of a cell membrane, which is the covering, the outer of portion of the cell, and then inside the cell is the nucleus. And the nucleus contains the chromosomes. And you may have heard of words like DNA or genes. These are nothing but segments of chromosomes, which carry all the information necessary for the cell to grow, survive, and multiply. So normally what happens is that when we are born, we begin with one cell, and then one cell multiplies into two, two into four, and so on. And that is how tissue is formed in the body. What is generally believed is that cancer cells also divide, but they have an uncontrolled way of dividing. So these are the normal cells that divide in a regulated fashion. And cancer cells lose that ability to control their proliferation or multiplication, and they are like a naughty child who is not behaving and regulating the behavior, and that leads to formation of cancer and growth and spread. So what's the difference between a normal cell and a cancer cell? So normal cells have a regulated cell division. They have programmed cell death. They respond to external growth and anti-growth signals. They have a balance between blood vessel development and cell need. And they have no tissue invasion. So what does that mean? Now, in cancer cells, there is unregulated cell division. What that means is that the division of the cells, as I was mentioning before, is unregulated. So the cells sort of go crazy and keep dividing when they are not supposed to. Normal cells have programmed cell death, which means that the lifespan of a cell, which may be a few days, a few weeks, and then the cell is supposed to die. But cancer cells have lost that breaks, sort of the control that allows it to decide when it needs to die. Normal cells respond to external growth and anti-growth signals. So on these for these cells to grow and multiply, there are signals that the cells receive such that it knows that now it's time to grow and now it's time to not. And cancer cells lose that regulation. Normal cells have a balance between blood vessel development and cell need. So each cell, be it normal or cancerous, requires blood vessels to provide it nutrition. And cancer cells have excessive blood vessel growth. And finally, cancer cells have a tendency to invade the organs. What that means is it likes to grow beyond what it's allowed to and go to other parts of the body. In 2011, Hanahan and et al. Had published this paper in the journal Cell, where they described the hallmarks of cancer progression. And I don't want to scare you by this figure over here, but basically what it shows is what I was mentioning before, that cancer cells have lost the ability to determine when they should die, when they should stop growing, and they just replicate and try to invade into different organs uncontrollably. So in 2019, there was an excellent publication that was presented in the Lancet Oncology, which is one of the top journals, in which a group of Indian researchers, they published the incidence, meaning the prevalence, the number of cases of cancer in India. On the left is the map with different states in India that have cancers in 1990. And on the right, it is from 2016. The darker shades, the ones in orange and red, represent higher number of cases. So about 90 cases or 100 cases per 100,000, which demarcates the red and orange, whereas the green and the blue cases are the lower ones. As you can see that in almost every state, there has been an increase in the incidence of cancers. In this publication, they said that there is about an increase of 28% of cancers in India when you compare from 1990 to 2016. Granted, this could just be related to greater detection because now there are better technologies available in India. but a lot of it is also related to the lifestyle changes and the westernization of the lifestyle that has happened in India in the past decade. In the same paper, they mentioned about what the top cancers are in India. And on this left chart, you see the top 5 cancers that are present in India are stomach cancer, breast cancer, lung cancer, lip and oral cavity cancer, and pharynx cancer, which is basically cancer that is behind the oral cavity inside the mouth area. In women, the most common cancers are breast cancer, cervical cancer. Cervix is basically an organ that is present just below the uterus in women, and stomach cancer. These are the top 3 cancers. And in men, lung cancer, lip and oral cavity cancer, and pharynx cancer. And these 3 are all cancers related to smoking and tobacco, which is very prevalent in India. There is a comparison between the types of cancers that were more prevalent in 1990 versus 2016. So you can see that cervical cancer and stomach cancer incidence has actually gone down, which is great. And why would that be? So that may be related to better availability of screening. So cervical cancer can be detected by pap smears in women, and that has increased in the recent decade. That's why the number of cases have gone down. And the cases of stomach cancer have gone down probably because of availability of more refrigeration and hygienic food available now. But you can see that the incidence of lip and oral cavity cancer has gone up, and even breast cancer has gone up. And why may that be? One of the reasons why breast cancer has become more prevalent is because of better detection, and also because of women getting pregnant and having children at a much later age. The reason for lip and oral cavity cancer to be more is definitely because of greater use of tobacco, smoking, and alcohol use in the recent past. Now, a lot of patients ask me, why did I get cancer? What are the risk factors of cancer? And what I tell, for most patients, we may not be able to identify any risk for cancer. We just tell patients it may be something in the environment or something that you may have been exposed to. But there are some risk factors that we do know about, which I'm going to present next in these slides. So age is a common risk factor for cancer. So cancer in general is a disease of aging. As these cells in our body multiply over time, errors accumulate in the DNA. And when these errors build up, it tends to increase the chance of getting cancer. So the median age for cancers is 66 years old. Older people get cancer. 25% of new diagnoses of cancer are in people between the ages of 65 and 74. Carcinogens, which means cancer-causing agents, damage the DNA that is present inside the cells of our body. And smoking, chewing tobacco, or secondhand smoke are some of the highest causing sources of cancer. In the USA, 30% of cancer deaths are related to smoking, believe it or not. And some of the common cancers that are related to smoking are brain cancer, throat cancer, lung cancer, stomach cancer, liver cancer, pancreas cancer. In fact, almost every cancer can have a risk factor of smoking related to it. Some of the other causes of cancer could be something exposed in the environment. So this is not always identifiable. So there are people who work in mining, welding, agriculture, which is very common in India, manufacturing, printing, the inks for that people get exposed to in the printing press, certain paints. All of these things can be a risk for cancer. There's no way to test and directly see the association between these exposures and cancer. But sometimes these paints or inks contain chemicals like some of these heavy metals that you can see, or benzene in it, which are commonly related to cancer. UV rays can cause skin cancer, and that's why applying a sunblock when going out in the sun is very important. There are some viruses and bacteria that can cause cancer. I'm going to be coming back to this human papilloma virus, also called HPV, which is associated with some common cancers, and I'm going to be coming back to that in a minute. Hepatitis B and C are now gradually going down because there is availability of vaccines for hepatitis B, but these viruses can cause liver cancer. Some people ask about inherited cancers. So these are not very common, but about 5 to 10% of cancers are caused because of inherited mutations. So what does that mean? So as I mentioned before that, this is a cell, and inside the cell, there is this chromosome and DNA that's present. If you go deeper and look under the microscope, you may be able to see some of the nucleotides that represent the DNA. And in some patients, in about 5 to 10% of patients have mutations, which is basically errors in the DNA inside these cancer cells. And patients sometimes have hereditary cancer syndromes where you can see that multiple people in the family have similar cancers. So for example, BRCA1 and BRCA2 are genes that are mutated in families and can cause cancers like breast cancer, ovarian cancer, prostate cancer, and pancreatic cancer that tend to run in the families. Now, a very common cause of cancer, or at least a link to cancer, is excessive body weight. So in the United States, 20% of cancers have been associated with obesity. And unfortunately in India, because of the adaptation of some of the Western lifestyle, now obesity is increasing and can be associated with the rise of cancer cases in India. A lot of different cancers are associated with obesity, as you can see here. Now, because of the fact obesity has become an epidemic in the world, the World Health Organization has put out guidelines that adults should engage in 150 to 300 minutes of moderate intensity physical activity per week. And what the moderate intensity physical activity means is that either brisk walking or treadmill or bicycle, either that or 75 to 150 minutes of vigorous intensity activity, which could include running or playing active sports. So it's very important to increase physical activity in our daily routine. And this will be focused more in some of the upcoming lectures in the next few days. Healthy diet is very important to incorporate, and that can help to overcome obesity. So eating foods that are high in nutrients and low in calories, vegetables that are dark green, red, and fiber-rich legumes, so beans and peas, fruits and whole grains, and limiting things that are high in red and processed meats, sugar-sweetened beverages, like the Coca-Cola and the carbonated beverages that are available, and highly processed foods should be avoided. One should try to limit alcohol consumption. Now, unfortunately, alcohol consumption has been going up in India in the recent past. And alcohol is associated with many different types of cancer, including oral cavity cancer, larynx, which is basically the voice box, liver cancer, esophagus cancer. Esophagus is a tube that connects the mouth to the stomach. In women, breast cancer and colon cancer. And currently, their guidelines suggest that it's best to not drink alcohol, but if one must drink alcohol, then it should be limited to less than 1 drink per day in women and less than 2 drinks per day in men. Now, the top 3 cancers, breast cancer, lip and oral cavity cancer, and cervical cancer, the good news is that even though they comprise 34% of the cancers that are present in India at present, these top 3 cancers can be detected early and prevented. So what can be done about that? So first, I'm going to mention about cervical cancer. To remind you again, cervix is an organ that is present just below the uterus in women, and it's a very common cause of cancer in women in India. What causes cervical cancer? Virus. So there are these 2 viruses, HPV, which is human papilloma virus, 16 and 18. Those are the most common causes of cervical cancer. Cervical cancer has a 10 to 20 year precancerous state, meaning before it becomes cancerous, for 10 to 20 years, it is in this precancerous state. And the reason that's important to know is that if you can identify or pick this cancer in its precancerous state, then you can potentially not have cervical cancer. And how do you pick it up? By the doctors doing either visual inspection, pap smears, or HPV DNA testing. So the World Health Organization has recommended that in resource-poor countries, a woman should get screened for cervical cancer at least once in her lifetime. And once that is achieved, screening for cervical cancer should occur at more regular intervals, 5 years or 10 years. And that should happen for women who are above the age of 30. There is also an availability of these HPV vaccine that has now become available to prevent getting cervical cancer. Now, the same virus, the HPV, it causes cervical cancer in women, but in men, it can cause cancer of the penis, and it can also cause genital warts. So this vaccine is available for both boys and girls, and there is a 2-dose regimen that is available for boys and girls to take less than 15 years of age. So this is something to bring up with your primary care doctor who is able to provide this vaccine. Now the oral cancer. So oral cancer is caused by tobacco smoking, so cigarettes or bidis, but also by smokeless tobacco use, which includes the pan, the betel quid chewing, and the areca nut, and sweeteners, and alcohol. These are all common causes of oral cancer. The virus that I mentioned that can cause cervical cancer in the prior slide, it can also cause oropharynx cancer. Oropharynx is basically the part of our throat, which is just behind the mouth. And even oral cancer has precancerous lesions, meaning before cancer is formed, it leaves produces a whitish substance in our mouth that one can easily detect by visual examination. So in a high-risk population, so people who smoke tobacco or chew tobacco, after the age of 35, they should get screening every 3 years in high-risk population. I was actually in India at Tata Memorial Hospital a few years ago, and I witnessed their screening program. They have an excellent screening program for oral cancer and cervical cancer. So everyone in Mumbai should try to take advantage of their screening services. Breast cancer, which is also within the top 3 cancers in India. It should be detected by breast exam. So most of the times the lumps are identified by women when they are showering. And mammograms and ultrasounds for women between the age of 40 and 60 years should be done every 3 years. And for women who have a family history of breast cancer or ovarian cancer, which is cancer of the ovaries, they should get screening at an even younger age. So these are, again, things to bring up to your primary care doctor. So what are the potential signs and symptoms of cancer? Now, the ones that I have listed here, they don't necessarily mean that you have cancer. So you don't have to get panicked when you have one of these symptoms. For example, a new lump anywhere in the body, a sore that is not healing, there is a mole that is changing size or shape, blood in the stools or in the urine, change in bowel habits, change in the voice, difficulty passing urine, unexplained weight loss, after attaining menopause if a woman is having bleeding, unexplained pain or aches. These are all potential signs, and one should not freak out about it, but also one should not leave it ignored. That is one of the things that I have seen a lot of times when patients just ignore that, oh, nothing's going to happen. This is just going to go away. I'm not going to bring it up to the doctor. Otherwise, things will get worse. Those are things I think that are the source of ignorance. And I think we should completely avoid that. Now I'm going to switch gears and talk a little bit about the different types of cancer therapies. I'm not going to go into too much detail about this, but I'm happy to answer questions regarding this later on. So whenever someone talks about treating cancer, basically there are two different approaches. One is local therapy. And what local therapy means is that you try to treat the cancer directly. And that can be done either by surgery or radiation therapy. So surgery is basically going in and removing the cancer. It can be used to either diagnose or treat the cancer. And usually surgery is performed when the cancer has not spread. So it's limited to one organ so that the surgeon can go in and remove all the cancer. Usually when a patient has cancer that has spread from the original organ to a different place in the body, surgery is usually avoided because surgery, the goal of surgery is essentially to see if we are able to cure the cancer or decrease the bulk of the cancer. And the other type of other type of local therapy that's commonly used is called radiation therapy, which is nothing but high energy X-ray beams that are directed against the tumor to try to kill the cancer. The other type of cancer therapy is what we call systemic therapy. And what that means is treatment that goes everywhere in the body. And the first type of systemic therapy is called hormonal therapy. Now, hormonal therapy is commonly used in breast cancer and prostate cancer because these cancers tend to respond to the changes in the levels of hormones. In breast cancer, estrogen, and in prostate cancer, testosterone. But it's not used in all other different types of cancers. Chemotherapy is something that everyone has heard about. And chemotherapy is a type of systemic therapy that can either be given IV, meaning in the vein, or it can be given by mouth. And it's supposed to go everywhere in the body and try to kill cancer cells. Sometimes when people have an initial tumor that spreads and the person has surgery, then to kill any residual cancer cells that may still be present in the body, chemotherapy is used. And now more recently, there is a type of treatment called immunotherapy that has come about. Immunotherapy is a type of medicine. The way it works is that it stimulates the body's immune system to fight cancer. Immunotherapy has shown a lot of promise in the past 5 to 10 years, and it's used in multiple cancers like lung cancer, skin cancer, kidney cancer, bladder cancer, and so on and so forth. And basically what it does is it releases the brakes off of the body's immune system so that the body's own immune system can attack cancer. And it has shown a lot of promise recently. So in the next few slides, I'm going to be going into some of the facts and myths about cancer. So patients a lot of times ask me, I've read on the internet, eating sugar makes cancer worse. Is it true or false? Now, in general, cancer cells do consume more glucose or sugar than normal cells, but there are no studies that have shown that eating sugar will make cancer worse or stopping sugar will make cancer shrink. So I tell patients that you do need to take sugar because sugar is a fuel for our brain. So we do need glucose in the body. However, as I mentioned before, obesity is one of the risk factors for cancer. So avoid a high sugar diet because a high sugar diet can lead to weight gain, obesity, also cardiovascular risk, which is increasing heart disease, and also risk for cancer. So in that sense, I would say one should try to limit a high sugar diet. Another common myth is cancer is contagious. Is that true? Contagious meaning it can be passed on from one individual to another. And the answer in general is no. The only situation where cancer can spread from one person to another is if someone who has cancer donates their organ to someone else. And that could lead to cancer passing on to the other individual. But in general, when caregivers are taking care of their family members with cancer, they are not going to contract cancer from the patient. There are some other types of cancers which are caused by viruses, like the human papilloma virus and the bacteria, like H. pylori bacteria, which can cause stomach cancers. And these viruses and bacteria, they can spread from person to person. However, the cancer itself cannot spread. Another question that's commonly asked is that if someone in my family has cancer, then there is a chance that I will get cancer too. Not always true. Majority of the cancers are not inherited, which means it's not in the DNA when you are born. And all the risks for cancers and mutations are acquired during your lifetime. But about 5 to 10% of the cancers, and I mentioned before about the BRCA1 mutation, they can be caused by harmful mutations that can be inherited from parents. A lot of people ask me, a lot of my patients in the US ask me, can I take vitamins? What supplements can I take to prevent or treat cancer? Unfortunately, there is not enough proof that multivitamins or mineral supplements can help to prevent cancer. Usually what I tell my patients is that it's okay to take a 1-a-day type of medication, vitamin over the counter, but I would avoid taking mega doses of vitamins. So there are some people who get intravenous vitamin C or high dose vitamin C or high dose vitamin A. And some of those cancers, those can actually be harmful for you. One of the things that I would recommend if someone has questions about any herbs or anything like that is to visit a website by Memorial Sloan Kettering called About Herbs. And this particular website is very handy. So you can actually go in this website and you can type any herb. So for example, if you're curious about, let's say, trifla or turmeric or anything like that, and you're not sure whether you can take that along with chemotherapy, for example, you can go to this Memorial Sloan Kettering About Herbs website, and you can just type the name of the herb. And it will give all the information about it, including citations about whether there is an interaction between a particular herb and some allopathic medicine or not. So I find this really helpful, and it can be a good tool. Finally, I want to end this talk by talking about how to cope with cancer. So by now, I have given you so much information, and I'm sure I've scared you about cancer. And it is scary to have cancer. Nobody wants to hear the C word. What's important, however, is cancer is very common, but there are ways to prevent it. And the way you want to do that is by adopting screening and prevention, the ones that I mentioned. Not for all cancers, we don't have a way to screen and prevent, but the cancers for which we do, for example, the oral cancer, cervical cancer, breast cancer, colon cancer, take advantage of the screening options that are available. Early detection is key. Most cancers, when detected at an early stage before it has spread from the original organ to a different organ, can be cured. And so listen to your body's signs. And if there is any symptom, don't be afraid to seek medical advice. Don't think that if I just don't worry about it, it will go away. That usually doesn't happen. Another part I would suggest is that involving the patient. So in India, I have seen a lot of times that the family wants to protect the patient and not inform the patient about cancer because they worry that involving the patient will make the patient give up or go into depression. But my experience treating patients has been that if you involve the patient along with the family, then in general, the care of the patient goes much better. It also relieves some of the burden from the caregiver. And involving the patient can help in important decision-making. It can also help in planning about what are we going to do if things don't go well. Next, I would recommend is building a good relationship with your doctor. I cannot emphasize this enough. I have heard so many families just being scared to talk to their doctor because if they ask the doctor a question, then the doctor is going to think that you don't trust them. That is not true. In fact, doctors realize that patients are not aware about this and are already overwhelmed. So please ask your doctors hard questions, difficult questions, ask repeated questions until you are satisfied. Caregiver emotional burden is often understated, and it's very important for caregivers to split the burden and not have to go through this by yourself. Because if the caregiver is not strong enough to take care of the patient, then the patient's care is also going to suffer. Finally, support groups. So if you go to National Cancer Institute website and search support groups, I just looked at it today and they have 104 support groups. So these support groups are for multiple different reasons. It is for the caregiver, it's for the patient. You could find other patients with the same type of cancer that you have across the world and find out how they are getting treatment and how they are coping with treatment. And so I think it's important for patients to realize that they are not alone and there is a whole world out there who is there to support them. That's all I had today, and I'm happy to answer any questions. Once again, I want to thank you for this opportunity to present today.
Thank you so much, Pooja. And now I think it's time for the participants to ask any questions based on the vast information you have shared.
Hello, Pooja ma'am.
Yes, hi.
Hi, my name is Ranjita. Actually, my husband, he's 42 years old. We recently, like 3 weeks back, we got to know that he has lung cancer with brain metastasis. And his history is something like he doesn't smoke and he doesn't have any bad habits. Really, we are shocked. And presently, he's undergoing radiotherapy, and we are waiting for the report. So I request, and also just wanted to know what will be good for him now at this stage, and your guidance to me.
I'm sorry to hear about your husband. It's indeed like very sad to have that at such a young age. You know, there are some types of cancers that lung cancer that happen in people who have never smoked in their life. Some of them have mutations in their tumor. Specifically, there's a type of mutation called EGFR. It's going to be hard for me to give you advice without knowing everything about your husband. But what I would recommend is I want to make sure that they send his tumor tissue for molecular testing, because at least in the United States, lung cancer the treatment for it is fully based on molecular testing. So making sure that the tumor tissue was sent out for genetic mutation testing. So trying to figure out what mutations there are, because lung cancer is not one disease anymore. Based on the different mutations, there are different types of treatments one would get. It would be hard for me to advise you specifically for your husband what to do. I can only advise you generally right now. I hope that was helpful.
Okay, yeah, thanks. Actually, we have sent the testing for immunohistochemistry. We are waiting for the report. So once the report come, maybe, actually we are staying in Bangalore. I think we do not get genetic tests and all done in Bangalore. I think we have to send it to Mumbai or some other different location.
Chandru, right? So Chandru, I can guide you with that in Bangalore or Mumbai, where it can be done. The genetic testing and molecular testing, what Dr. Pooja is talking about, we are doing it for cancer patients. So I will just leave my number here, and then I can guide you on the same after the session.
Okay, and I have one more question. He's having a 3-year-old and 9-year-old. So is there any kind of test we have to undergo with the kids to check whether they also in future maybe to avoid something like this?
Yep, that's a good question. A lot of it depends upon the family history. If there are any other cancers, in general, if lung cancer is the only cancer in the family that your husband has, then the chances that your children would have or his children would have inherited that mutation is very low. So I would say that in general, you would not need to rush to genetic testing unless there is a high family history of cancer.
Thank you. Thank you so much.
Hello, ma'am. Preeti here. Hello, Pooja, ma'am.
Yes, hi.
Yeah, hi, ma'am. Ma'am, my husband, he got detected with thyroid carcinoma in 2018, May, and he got operated. His entire thyroid gland got removed, and then our doctor said, we should not give him iodine therapy, but he should be under observation. And every 6 months we have to do thyroglobulin test. So in 2018, when we did thyroglobulin test in October, that time reading came normal. But when in 2019 April we did thyroglobulin test, it came high. It was around 540 something. So doctor told us go for PET scan and then go for iodine therapy. And he told us to do that slide review of his gland. So we did slide review 2 times because doctor was not convinced. He said in first review it came poorly differentiated carcinoma of thyroid gland. So he was like, because my husband is 40 years old, so he said, for this age it won't be, it's very rare. So he told us to repeat the test. We repeated the test and same thing came, poorly differentiated carcinoma. He advised us to go for PET scan, and when we did PET scan in 2019, there were some nodules in his lungs and retroclavicular area. So doctor said, see, in your case, it is poorly differentiated carcinoma. So it's like go for iodine therapy, but again, there are chances of 50-50. We cannot say anything. So we did scanning, and by grace of God, that cells took the iodine, and then doctor did iodine therapy. But again, he said he will be under observation. We repeated PET scan this year in 2020, 1 month back. Again, it was like there were some nodules which has increased in size, but it's like 1920. It has not gone too much. So doctor said we'll wait for some time, and then we can take any decision. And meanwhile, we have started with Ayurvedic treatment also, because there were a lot of questions in our mind, and we were like, because doctors are saying in your case we cannot say anything. We cannot say it will be cured by 90% because it is poorly differentiated carcinoma. And ma'am, my husband, he's fit and fine, he's going to work, he's doing everything. What he told me, Preeti, I'm not feeling anything. Internally also I'm not feeling anything. I'm doing my work and I'm active. He does his exercise, everything, all the routine he's following. He told me, then why this is coming? I'm not feeling that I'm sick. Yeah. And and one more question, ma'am. See, I was giving him naturopath diet because I'm a dietitian. But when I switched to Ayurvedic treatment, they told me to give him milk products, and carb in for breakfast and lunch and for dinner. So I don't know, somehow I'm not convinced with that, because naturopath and Ayurveda, they are totally different. In naturopath, we say use a lot of raw food, take green veggies, and there are certain juice which we can include. But Ayurveda, they say totally different, because doctor told us not to follow any raw food diet. So there is a lot of confusion at this stage in my mind, so wanted to clear that.
Yeah. Thanks, Preeti, for that question. So first, I will say that I agree with the treatment course that your doctor has suggested. I would have recommended the same. So I think you are on the right track. The other question you asked about why does he not have any symptoms? It's actually very, very common for a lot of people who have cancer that has spread to not have any symptoms, especially young people, young and fit people. A lot of times because their body has a lot of reserve, even if there is cancer growing in the body, sometimes they don't feel it. And that's the reason why we do these scans and things like that to pick up sooner than when he would start having symptoms. The third question about Ayurveda and naturotherapy, I think that some of the upcoming talks in the next few days will probably be able to answer those questions with much better expertise than myself. So I would probably defer that to them.
Okay, thank you so much, ma'am.
Hello, Pooja ma'am.
Yes. Hi.
Hello, Pooja ma'am.
Hi.
Hey, ma'am, I have a question that does it matter if one goes with the generic drugs or the branded drugs for the chemotherapy?
No, it should not matter. One of the things I would double check is, so I had an experience of working in Tata Memorial Cancer, Kolkata. And one of the things that I sort of learned from there is that sometimes the drugs that are given, they are just like watered down, or there is no good regulation, is what I've heard in India, as far as how these drugs, they don't come from one manufacturer, and so it's hard to sort of guide. So in general, there is some concern about that I have heard from physicians in India. But I would say that it doesn't matter whether it's generic or brand.
Because there is vast variation in the prices also of the generic
Tell me
drugs.
about that.
Like I have heard some of the good drugs, Pfizer and Fresenius Kabi. I thought these are good drugs, but there are some generic drugs also which are being used in the chemotherapy. So yeah. Okay. I have another question, ma'am, that the calcium supplements that are given to women's, like mostly Shelcal is prescribed here in India, and some B complex neurobion which people are taking. I have seen on the that they have some titanium dioxide present in it. So they have whitish coating because of the titanium dioxide, which I researched and checked that it is a carcinogen. It's a carcinogen in nature. So whether a cancer patient should take these supplements having titanium dioxide written on it?
I would say that it is okay to take the medication. So in general, everything, if you Google, you may find that there is a link to cancer. Pretty much anything that you look up, you may be able to find it. But in general, these small quantities of these metals that are present in the vitamin, over-the-counter vitamin tablets, they don't necessarily cause cancer. I would say that if your doctor has recommended the use of calcium, or in women in general, to prevent osteoporosis, you should continue to take it, and I wouldn't worry about the risk.
Okay. And ma'am, in breast cancer, do we have the option of going for bone scan for the stage 1 breast cancer? Do we have the option of bone scan? Because I underwent surgery in November 2020, and my BCS was done, and the tumor was around 2 to 3 centimeters, and now the doctors said that it's a stage 1 cancer, so I can go for bone scan or I may not go. That doesn't matter much. So or any other scan, because I have not undergone any other scan like CT scan. Just my lump was detected and it was operated and BCS was done. And after that, now I am on chemotherapy. So what I'm worrying is that if there is any other issue in the body, how would we know about it? And second thing is that if the scan is not required, because these also have side effects, so what should I decide, whether I should go for any other scan or not?
Yeah, so that's a good question. In general, we follow the NCCN guidelines, which is the National Cancer Center guidelines in the US. And basically for patients who have breast cancer that has been treated, we do not recommend CT scans or bone scans in general. We usually rely on patient symptoms. While breast cancer does have a tendency to spread to the bones, it's much less common than spread to any of the other organs. And so if you really felt that you should get some sort of screening, then I would say probably go with CT scan rather than doing a bone scan, because it has lesser yield.
Okay. And ma'am, the hormonal therapy which is given for the breast cancer, so these hormonal therapies should be started after chemo and radiation, or they should be started along with the chemotherapy?
It's usually after chemotherapy and radiation therapy.
And doctor, I had a question. I have a family history. My mother passed away because of cancer. Her mother, her sister, her brother, they all had cancer. So I just got a, DNA testing done outside, and 2 cancer forms came on high risk. One was pancreatic and the other one was prostate. So the doctor just told me you do a PSA test every year. So that was one advice he gave. But I just wanted to know for pancreatic cancer, what are the symptoms and how can one take care of it?
Yeah, so 2 points. One is that are you aware when they did the genetic testing in your blood, which gene was mutated? Do you know the name of that?
So I'll just pick up that report and I'll send it on the chat. I don't remember it offhand. I'll just pick it up right now.
Yep. So it sounds like there is a type of gene called BRCA, BRCA, which has a high risk of prostate, pancreatic, breast, and ovarian cancers. And so that would be one of the things I would be worried about. Now, for prostate cancer, I agree there is a screening test, a PSA test, which is a simple blood test that can be done. For pancreatic cancer, unfortunately, there is no real screening that is done. Pancreatic cancer symptoms usually are weight loss, abdominal pain, indigestion. So the symptoms of pancreatic cancer are really vague. They're not very specific. And there is also no easy way to get screening for that. So in general, we don't recommend screening for pancreatic cancer with CT scans every year or anything like that. But certainly the history that you mentioned sounds very, it's very suspicious. And so one of the things you could also do is talk to a genetic counselor. So over here we have, patients who we have a high risk for hereditary cancers. We refer them to genetic counselors who are able to provide a good regime of when you should get screening, based on the available data. So that's something you could pursue.
Thank you very much.
Hi, doctor. My mom, I'm speaking on behalf of my mother. She currently has triple negative breast cancer, which has spread to the lungs, so metastatic triple negative breast cancer. We've gone through about 6 to 7 different lines of treatment. This includes eribulin, this includes capecitabine, nab-paclitaxel, and all of these other medications. Most recently, we treated her with nab-paclitaxel and in a combination with another drug, and we gave her about 18 rounds of chemotherapy treatment. So at the 12th or 15th mark, we did a PET scan, and the result was very good. It was the disease had significantly reduced, but after the 3rd or 4th scan post that, the disease seems to have increased again. So the doctor has recommended a medication called sacituzumab govitecan, which recently got FDA approval, if I'm not wrong. Unfortunately, this is only available in the US. So I'm in India. I'm based in India. I was wondering if you think the drug is worth the effort of sourcing it and importing it into India, because it's extremely expensive. I think to the tune of $6,000 to $7,000, the entire logistical effort. And post that, it's not just for one dose, right? This would probably require 6 to 7 doses. So if you think that it would make a significant difference, or if there is any other line of medication that's new and probably more easily available.
Yeah. So, I agree that sacituzumab govitecan is now, FDA approved for triple negative breast cancer. In general, when patients have metastatic triple-negative breast cancer, the treatments are usually different types of chemotherapies that you mentioned. In those who have, something called as PD-L1 positive triple-negative breast cancer, that's something that's identified by immunohistochemistry. They can also get immunotherapy that is also currently approved.
So we've done PD-L1 testing using SP142 Ventana assay, and the results are not great. So we don't think PD-L1 immunotherapy would work.
Okay. Yeah. Unfortunately, there are not other great options that are available for triple-negative breast cancer. Patients like this over here, we would usually enroll them onto clinical trials. Have they done molecular testing, like sent the tumor tissue for molecular testing?
NGS testing.
Yeah, we've done NGS testing. Is that the same? Yeah. Okay.
Yes. And were there any targetable mutations that they identified from that?
No, unfortunately not. We couldn't do that either.
But that's doctor said immunotherapy will not work.
Yeah, immunotherapy is ruled out.
Okay.
Yeah.
Sounds like it was PD negative. Yeah.
Correct. It was like 0 to 1, very low score. So in terms of the drug Govitasen, do you think it's worth the effort then to go through the entire logistical effort to bring it to India?
I don't know the details about the efficacy of this particular drug in breast cancer, but I can certainly look up and let you know if you want to shoot me an email later on.
Okay, thank you so much. I'll do that. Email address, is that available? Okay.
Doctor's email ID.
Madam, hello. Madam, Madam, for the stage 1 HER2 positive breast cancer, how many cycles of trastuzumab is compulsorily to be taken?
This is stage 1?
Stage 1, HER2 positive. So trastuzumab cycles, how many cycles should compulsorily be taken by the patient?
So in general over here, we recommend they should complete Herceptin for a year, adjuvant therapy.
Yeah. Okay. So there are 17 or 18 cycles, madam?
Yeah, so it's like given every 3 weeks. So yeah.
17 or 18 cycles, madam?
Yes. Yes, that would be right.
Whatever 5 minutes.
Doctor, I just pulled up the report that you wanted. There are 3 genes that have got mutated. The first one is NRSA2, the second one is ABO, and the third one is FABSL1.
I'm sorry, I don't know which person this is referring. This question is.
I had asked you this question on pancreatic cancer actually. So you told me to look up the genetic report. So
I see. So none of those genes sounded like a typical syndrome of cancer. Yeah. Is there anything like MSH2, MSH6, MLH1, BRCA, anything like that?
No, these are the 3. Only 3 have been mentioned here. That's all.
Okay. These are not. There are no known syndromes that are directly associated with mutations in those. But it's not uncommon for us to have patients with very strong family history of cancers, and we are not able to identify any known mutation. And that's because we just don't know that much about this field. There are many more mutations that are probably associated with hereditary cancers that we don't know about yet.
Sure. Thank you.
Good afternoon, ma'am. May I speak?
Hi.
Hello.
Hi.
Good afternoon, ma'am. Okay, I'm Vikas calling. I'm a 55-year-old person calling from Chandigarh. I was detected with the GBM last March, ma'am, and I was operated upon thereafter and underwent radiation sessions and followed by chemotherapy of temozolomide. Completed 6 sessions. In December, I had a small reoccurrence, and thereafter I was advised to undergo a fractionated SRT, high-dose SRT, which I underwent at Bombay. And now I'm undergoing chemo with the Avastin and one more drug they're combining with that. I'm forgetting the name. So I just wanted to, I've got 2 queries. Firstly, I just wanted to check, is the line of treatment correct? That is one. Second is that you enumerated a lot of causative factors for the cancer to happen, but unfortunately, I didn't have any of those causative factors like smoking, drinking, obesity, exposure to radiation, any of those things. But still, it was there. I find that is fait accompli. I don't have any cribs about it. Why did I get it? It had to happen, so it had happened. So I'm taking it that part as positively. But my thing is, what is the next course of action after this for my treatment? However, as far the reports are concerned, I'll share it with you because I don't have the reports with me. I'm in the office right now, so I'll share it with you online on a email ID, and thereafter you can we can discuss it out maybe on the email or as it's convenient to you. Thank you, ma'am.
I'm sorry to hear, Vikas, that you're going through this. Thank you for joining the call today. I agree with the treatment line that is ongoing. Unfortunately, GBM is a nasty cancer. And I'm glad that your cancer has been staying under good control. There have not been any known causative factors for this glioblastoma multiforme brain tumor. And you don't have to take it upon yourself because it's just something that we don't have any data to really find a good causative factor. So I'm not a brain cancer expert. So if you have questions about like nth line of treatment, I'm happy to get recommendations from someone who treats mainly brain cancers, because that field has become very, very specialized now.
Hello, madam. This is Sudipta.
Can we have an email ID so that we can communicate later on this?
Sure. I'll give it to Dr. Singhi, and she can then send it to you guys.
Fair enough, ma'am. Thank you, ma'am.
Hello, madam. This is Sudipta here. This question regarding my father, who has detected prostate cancer in September last year in 2020. So it was found that his PSA level is 100 plus, and this is a 4th stage metastatic prostate cancer, and they have given the pamorelin hormone therapy, and after a quarterly review, we found out that the PSA level coming down to 0.12. So yeah, thank you, madam. So I just wanted to know, can we delay this radiation process further, or this hormone therapy is good enough to take for another 2-3 quarters, or how to progress for the treatment?
Were they planning to do radiation therapy to the prostate?
Yes, actually, you are in touch with 2 of the oncologists. First is the medical oncologist who given the hormone therapy, pamorelin, and after that they said that for further action you can consult the radiation, which I haven't gone for yet. So I just wanted to know, should I, as the PSA level has decreased, should I go immediately for the radiation therapy, or I can wait for some time for the radiation therapy?
Yeah. So prostate cancer is my area of expertise, so I can definitely guide you for this particular case. So the first point is that whenever someone has metastatic prostate cancer, which means cancer that is spread from prostate to other parts of the body, in general, we cannot cure this type of cancer. So this hormonal therapy that they are taking right now is to sort of keep the testosterone levels low, to keep the cancer under control. The natural history of this disease is that so long as the hormone therapy is continuing over the next months to years, the person is going to remain hormone sensitive, which means that the cancer cells are going to stay under control. But sometime down the road, and that could be a few months, few years, some of the cancer cells are going to become resistant to hormonal therapy. So definitely should continue the hormonal therapy. There is some data about whether or not to radiate prostate in people with metastatic prostate cancer. And basically what the data suggests is that...
just a moment, madam. I will stop you for a moment. He is 67 years old. That's why I am not sure whether, this radiation will have an adverse impact or not. So please continue, madam. Thank you.
So it depends upon what the volume of the cancer is. So there was a study that was done in patients with metastatic prostate cancer. Half of them just got hormonal therapy, no radiation therapy, and the other half of them got hormonal therapy along with radiation therapy to the prostate. And basically and it was a very big study. What the study found is that in people who have cancer that has spread to less than 4 places in the body, less than 4 bones, which is what they called low volume cancer, those patients benefited from radiation to the prostate. But people who have high volume cancer, which has spread to more than 4 places or 4 bones in the body, then those people did not benefit. So in your dad's case, if this is high volume, then I would say you don't need to rush to get radiation to the prostate right now. But if it is low volume cancer, meaning that the cancer has only spread to 1 or 2 places, then radiation to the prostate can help in the long run. But I agree, it's not something you need to rush to do right away. You could even wait a little more.
Thank you, madam. So can I share the PET CT scan which I have done in October 2020? So I don't know exactly whether it is a high volume or low volume. Nobody told me, my oncologist. So can I have can I get in touch with you just to go through whether it's a high volume or low volume, and whether you should go for the radiation or not?
We will. So we'll do one thing, everyone. First of all, thank you so much, Dr. Pooja, and thank you everyone for your queries, questions, and contribution. To make it systematic, I would do one thing. I have shared a form link in the chat. So मेरा आप सबसे request रहेगा कि आप लोग वो एक form भर दीजिए छोटा सा. So क्या होगा कि हर session के बाद में we would share a couple of details about the session. We will share doctor's email ID. We will share video of this session, and we will share updates on upcoming sessions which are coming. And if any other sessions are happening on integrative oncology, you will receive the regular updates on the email. So that, and also I have shared in the chat, एक मैंने integrative oncology group का link भेजा है. So those who want to be in touch on WhatsApp, they can join that group. And if you have any query about the speaker, let's say today is Dr. Pooja, the medical oncologist, then you can fill the form, and all the people who are filling up the form, we will share the email ID with you so that you can connect with the doctor directly. And I'm really sorry we are running short on time, so could not able to take all the questions, but would be happy to answer everybody's queries. We'll ensure that no query remains unanswered. And I've also shared a form, WhatsApp group, and my phone number. So any queries regarding anything, get in touch, and we'll ensure that we get answered for all of you. Really
one last question.
So you could have your questions on the link which Dimple has shared, because we are going strictly by time. I really understand the need and what a person goes through. And with the immense knowledge which Dr. Pooja has shared, in fact, it's become more like an online consultation for all of us. And with the simplicity with which she has shared it, which even common people like us can understand what goes and what happens with regards to into the body. And tomorrow we will be talking about what happens in the emotional self, the mental self. So there's huge plethora which is there. And I'm sure Dr. Pooja has lots to offer us, but because of the lack of time, and she being a researchist, we truly understand her time. So time is so precious, and we are really honored to have you on this platform, Dr. Pooja, because you have given us so much insight into what the particular disease is and how one can find the ray of hope. And it was a pleasure to start and have the opening of this session with your wonderful talk, which was so insightful. Despite your busy schedule, you have accommodated us and have ready to be a part of it. Thank you so much, Dr. Pooja, and all dear participants. Dimple has shared the link with you. Please join the link. You will be well scaffolded, and we have experts who will be able to help you through this journey. This is just a journey. Please do not take it as a destination. There is always a ray of hope. Thank you, Dr. Pooja. Thank you, Dimple. And thanks to each one of you for being here, and see you all tomorrow with much more. Now, today you have understood the disease. Tomorrow, let us see the mental and emotional wellness. So looking forward to seeing all of you, and keep smiling. There is always a ray of hope, and love heals anything in this world. Thank you so much, Dr. Pooja. And thank you, Dimple. Thank you to all of you On that note, have a wonderful day and week ahead. See you all for the next progressive sessions which are going to happen henceforth. Bye-bye for now. Thank you and namaste.